Dr. Horacio Odibert is an aging institute, an aging hospital, which needed to be redone. We had some old drawings that really didn't serve its purpose. So immediately we took new architects and focused in on redesigning and adding to what's there already. What we ended up with was a campus, basically for Aruba, and that included a new MOB center, which all the specialists will be housed in one building, three-story building. The next, the patient rooms, which was a tower building, and the way we designed this, we decided to design this for efficiency, was in a racetrack format, so that everything is centralized, efficiency is maximized. Our nurses and physicians needed to move less to get to the rooms and be able to act with the patients. So we're really looking at a much more efficient unit in the design itself. Also, the traffic of physicians and patients are separate from the traffic of the people that are visiting, and also all the products coming in and out of the hospital. So it's basically a really complete new design that we put down. We've got a 3 times bigger emergency care center. We have a location for all the utility facilities and gases and electric, water, everything that's being processed to go to the hospital is outside of the hospital now. So it's a plug and play center where you can expand the hospital on the outside without having to be invasive into the hospital. So we're looking at a complete new campus, a cost of 254 million guilders, paid back in a PPP project with SOHA, which will pay back starting in 2017 for 25 years. The project in such was not only building a house, which is our hospital, but really building a home. So looking at what our needs would be in the next 25 years, with all the technology that we're importing, with the vision that we put together in our kaderbrief, which is a letter that went out to the profession as soon as we started, and also with looking at our health monitor and seeing where our problems lie for the future. Together with our partners, together with everyone that works in the hospital, we've put together this plan, this new hospital that's going to be a state-of-the-art hospital, and that will serve us for the next 25 years. In St. Nicholas, we have a smaller clinic/hospital, Centro Médico. Centro Médico basically got redirected, and what we will be doing there is creating 3 centers of excellence. Our first center of excellence will be urgent care. The second one will be a diabetic center, carousel, meaning everything, all the way from dialysis to wound care to eye care, everything to do with diabetes, which is a big issue in our island. And kind of the crown jewel will be our oncology center. And our oncology center will be a complete center with radiotherapy, chemotherapy, and we're doing this together with Baptist Health South Florida, a very renowned chain of hospitals and specialized clinics. We'll be getting this facility, IMSUNG, JCI certified, so that we can actually also have medical tourism for the first time in Aruba, and specifically in the oncology area. And this is a project that actually will bring in money for Aruba at one point, and really got calculated for our population. So even if, let's say, the medical tourism didn't work, the only calculation we did to make this feasible, to see if it was feasible, was to look at our population of 110,000, 120,000, and say, okay, is it feasible to do these 3 things, and will this help our healthcare? Will this help our hospital, our care system in the island? And the answer is yes. So we're really moving forward. It's going to be a 30 million guilder investment that we're doing to create the bunker, linear accelerator, all the latest equipment that we're needing, retraining our physicians, getting specialized nursing in to do the jobs that we need to, and also starting to retrain our staff. One of the big projects that we've done, also in Horacio Odibert Hospital, that we're doing right now, and in our complete medical sector, and we're talking the primary care and secondary care, is really upgrading all our physicians and nurses by bringing in courses, by bringing in studies. We're working together with VU AMC, which is the big free university in Holland, in bringing in real specific courses that are needed, in having our specialists, our nurses specialize in what we need. So we'll have specialized nurses on oncology, specialized nurses in diabetes, etc. So really looking at our care and filling in what's needed. Our focus in our care has been our primary care.